years ago, the Cardiac Care Unit at St. Joseph Health Center was selected as the pilot program for the Service with Excellence initiative. The challenge was to create a healing environment, an atmosphere of care and compassion beyond the clinical aspects of care. First Touch was developed to give staff non-clinical personal contact with patients and their families. The pioneers of this program recently made a presentation to Carondelet Health's senior management team.
First touch is that initial personal contact, and it's a time of presence, a time of presence. And in the morning, we say our hellos to the patient, so we start off our days with hellos and our first touch, and it ends with our goodbyes at the end of the day. Now, I used to go into patients' rooms before we started this first touch. I used to go into patients' rooms in what I now describe as my armor, because I would be the nurse and I would have my blood pressure machine, my pills, my stethoscope around my neck. I would have my clipboard, because lots of patients going everywhere. I would connect with all that equipment. I would connect with the patient eventually, but I was almost the armor behind the equipment. I now think of that as what I used to do. Now what I do, I purposely, before I go into a patient's room in the morning to do my first touch, I leave my stethoscope down, I put it down, I leave my blood pressure machine out in the hallway, my pills, my datoscope, and I walk into a patient's room quietly, just me. And I go in and I sit down either at the side of the bed or on the bed, and depending on how I feel and what feels right, I may touch the patient, or I just may have a time of presence with them. And I go in and I say, "Good morning, my name is Maribeth. I'm your nurse today. How are you?" It's an open-ended question, person to person, and it opens many doors. I tell this story, some of you have heard it before, but it really speaks to the very heart of our First Touch initiative on our unit. The other day I was taking care of a patient, and I work on a cardiac care unit. It's a telemetry unit. And it was a Tuesday morning, and I was taking care of a patient that had heart arrhythmia problems, and she was about 75 to 80 years old. And I was up in the nurse's station, and all of a sudden the alarms went off, and she went into her fast, irregular heart rate. So I ran down to room 213 to check on the patient, and I walked in the room, and my first initial assessment was that she was okay. But as nurses always do, I wanted to grab her blood pressure to see, is she doing all right with her blood pressure? And on the CCU, our blood pressure cuffs are behind the patient's head, on the head of the bed. They're above the patient's head. And so I was reaching up to grab the blood pressure cuff, and I was like inches from her face. And as I was reaching up, all of a sudden, she grasped my hands, my face in her hands. She looks me straight in the eye, and she says, "Maribeth, you are wonderful." And I tell that story because it'll keep me coming back to nursing for the next 20 years. I'm going to be passing my pills with a walker, because it's moments like that. Those are the moments that we all have and that we all share in healthcare that keep us coming back, okay? Those are the moments. What was important about that moment, what relationship had we both nurtured that gave her the comfort level and trust to reach out and touch my face? What relationship had we both nurtured?
First Touch gave me permission to do the nursing that I have always wanted to do, that I had lost in the trappings of CCU, the vital signs every 15 minutes and all of the routine pills and all of that. And I had lost the patient in that, and I was able to regroup and remember that my relationship with that patient is the first priority, and then from there I can actually do the care of that patient. And so it really enlightened my job for me and made it easier to actually get there and get in the rooms and take care of the patients. And I like the part, and I think I said it that day, is that it gave me permission to get back to the heart of nursing.
One of the physical therapists who comes on our unit stopped me and said that she had been working with an intern sometime over the past few months that had been on our unit, and this young woman was so taken with our concept of first touch that she started using it throughout our hospital and found that it really worked to help her connect with her patients. She went back to her hospital, which I believe is in Minnesota, and called and asked if she could get materials from our unit about first touch so that they could present it to their hospital, because she felt like it was such a wonderful thing that it should be shared in other places. So now we kind of have a little satellite program somewhere north of us that saw the value of first touch just through a real informal introduction on our unit. So we were just thrilled that we were able to share that with someone that we didn't even know had been touched by our first touch.
Part of what we're doing is interviews with the doctors and the cardiologists, and one of our cardiologists, they were really cool interviews actually, because it again helped us to get to know them and them to get to know us. But one of our cardiologists says that it's important to give each other grace, and that's how that we asked him how could we work better together, and he just says it's important to give each other grace. And we just said, wow, that is way cool. That's what we're doing. That's first touch. I mean, he gets it and we get it, and it was just a wonderful way of expressing, what we're accomplishing.
I think also in doing the goodbyes, it kind of gives that time to finish with the patient, and part of that is saying, is there anything else I can do for you? And so we recognize that, like Mary Beth mentioned, there's that void in there when both sets of nurses are tied up in reports. So part of the responsibility is to kind of tidy up those ends, and in particular make sure that the patients are comfortable or have their pain medicine or have their belongings close to them. And I think it probably has helped in the sense that, particularly with our post-open heart patients, that to make sure that they do have pain medicine on board, so that when the next shift does get in there, their pain level isn't already to such a degree that the patient's already irritated. So
I've been a charge nurse on just weekends for about the last 3 years now. And before, I'd make rounds and I get lots of positive comments, but I've really noticed a change since we've been doing this from the patients more and more. And I'm just making it more of a effort to take those positive comments and make sure they go to the right mailbox, because it's I know it's really appreciated when someone says thank you, and I'm just more aware of that too.
I'm not in direct patient care any longer, but in helping the team develop this, I realized that not only does it benefit the nurse and benefit the patient and all our other customers out there, being the physicians and the other ancillary departments, but I realized that I was starting to practice first touch even when I was out in the community.
The team has been keeping track of specific indicators on their patient satisfaction scores and has seen improved scores in all areas.
It's not it's every day is, 100% this is working. There's different levels of it, but it is transitioning definitely from an awareness to a common practice. And it really does come from our hearts, and it really is working. And St. Joseph Health Center is great thank you so much for giving us this opportunity and to develop this. We really appreciate it, because it's who we are as persons and what we do, and like Jerry says, it gives us permission to do the total reason why we're in healthcare. So thank you.
First Touch is simple and elegant in a way for caregivers to connect with patients and make a difference in the outcomes of care. Pioneers have also found that it has made a difference in their own lives and the way that they do their work, which creates a rippling effect that goes throughout the organization and probably throughout the community. We owe them a great debt. We're grateful for the work they've done, the commitment that they have brought to this effort, and looking for ways to not only support them in their work, but finding ways to replicate this in other units throughout our institution. It's part of what our mission's about. It's part of what we commit to the community to deliver on a day-to-day basis. We're incredibly grateful to them and thank them for all that they've done.